Hi and welcome back to another video of Medic Notes. This video is on ankle fractures. Ankle fractures are very common injuries to the ankle which generally occur due to a twisting mechanism. Diagnosis is made with plain radiographs of the ankle. Treatment can be non-operative or operative depending on fracture displacement, ankle stability, presence of syndesmotic injury, and patient activity demands. Ankle fractures are common among 15 to 24 years old and 75 to 84 years old. Common locations are isolated malleolus fracture, bimalleolar, and trimalleolar fractures. Risk factors of ankle fractures are male, younger age, obesity, smoking, and alcohol consumption. Lauge Hansen classification is used in classification of ankle fractures, divided into four, which are the supination adduction, supination external rotation, pronation abduction, and pronation external rotation. Another commonly used classification is the Danie-Weber classification. Type A is infrasyndesmotic, Type B is transsyndesmotic, Type C is suprasyndesmotic. Patients present with severe ankle pain, with difficulty or inability to ambulate. On physical exam, there might be ecchymosis and swelling around the ankle. Deformity with displaced fractures. Palpate proximal fibula for Maisonneuve fracture. Look for soft tissue injury like fracture blisters, skin tending, and open wounds. The ankle motion is generally limited. Assess neurovascular status to look for peripheral vascular disease or diabetic neuropathy. For imaging, ankle radiographs with a P, lateral, and mortise view can be used to assess the fracture. If there is syndesmotic injury, there will be decreased tibiofibular overlap, increased medial clear space, and increased tibiofibular clear space. For lateral malleolus fracture, shortening of lateral malleoli fractures can lead to increased talocrural angle. For posterior malleolus fractures, possible findings are double contour sign, misty mountain sign, and spur sign. CT scan is indicated for trimalleolar ankle fracture and for operative planning. MRI scan can be used to rule out deltoid injury, syndesmotic injury, lateral ankle ligament complex, peroneal tendon injury, and chondral lesions of talus. Treatment can be conservative or operative. Conservative treatment is indicated for stable ankle fracture, isolated stable medial malleolus fracture, isolated stable lateral malleolus fracture, avulsion tip fractures of medial or lateral malleolus, posterior malleolar fracture with less than 25% joint involvement or less than 2 mm step-off, or patients unfit for surgery. We can offer short leg aus splint, short leg cast, and cam boot. Operative treatment can be open reduction internal fixation. This is for any talar displacement, bimalleolar or bimalleolar equivalent fracture, posterior malleolar fracture with more than 25% or more than 2 mm step-off, Maisonneuve fracture, Bosworth fracture dislocations, open fractures, and symptomatic malleolar non-unions. Another operative method is external fixation. Staging procedure in cases of severe open fractures with gross contamination, or poor soft tissue requiring close monitoring. Or for unstable reduction. That's all for this video. Thank you.